Pharmacology review, body systems, final exam, and VT&E review. Endocrine system. First drug that we have for the endocrine system is L-thyroxine, also called thyrosin. What condition does this treat? This treats hypothyroidism. Which species are most common? This most commonly happens in dogs and horses. Methimazole, also called tapazole. The condition that this treats is hyperthyroidism, hyper, too high. Which species is most common? And this is going to be cats. Regular insulin, also called Humulin R for one of the examples. The only insulin to go IV is regular insulin. Which route are all other insulins given? Subcutaneously. How long does this last? Short or long? This is a short-acting insulin. Cardiac drugs. Hemobendin, also called vetmedin. This is a positive inotrope and a balanced vasodilator. This is going to improve contractility, how the heart functions, and it'll dilate vessels. The condition that it treats is congestive heart failure in dogs. And side effects are low blood pressure, GI upset, nervousness, and kidney failure. The epinephrine, also called adrenaline, what does it do to the heart? It's going to improve short-term contractility. It's going to mimic the sympathetic nervous system. When do we give this drug? In emergencies for asystole. What routes? And how do we calculate the IT route? Intratracheal, intravenous, intracardiac, and intratracheal will be twice the dose of the IV. Where is it usually found in practice? In the refrigerator. Lidocaine, which condition does it usually treat in the heart? And this is going to be arrhythmias, disturbances in the normal heart rhythm. This is a class 1 antiarrhythmic. Propranolol, the condition that this usually treats is going to be treating arrhythmias, and this is a class 2 antiarrhythmic. The receptor that it blocks, this is a beta adrenergic blocking agent, a beta blocker. Mannitol, this is going to change the resorption of sodium. This is also going to reduce edema. And what happens to this drug at room temperature? This drug will crystallize at room temperature. So extra equipment is needed. We need a syringe filter, and we may or may not need a warm water bath. We don't want to inject crystals into the vessels. Furosemide, also called Lasix or Salix. This is going to reduce edema by preventing resorption of sodium or potassium from the renal tubules. The animal will be urinating more frequently. Enalapril, what does it do to the heart? This is going to cause expansion in the diameter of the blood vessels. It'll reduce the workload of the heart. Atropine, glycopyrrolate, you've seen this card before in our anticholinergics. It is going to increase the heart rate, and it'll help to reverse bradycardia. If this gets overcorrected, it becomes tachycardia. And what does it do to secretions such as saliva? It's going to decrease secretions, and it will dilate the pupils. Anticholinergics, you already have this card. Remember that this in horses can cause ileus, so we need to monitor them for colic. It should be given only when clinically needed, although some veterinarians will still use it as a pre-anesthetic in their regimen. And when given to rabbits, remember 30 to 50% of rabbits have atropine esterase, which is an enzyme that breaks down atropine and makes it less efficient. And when we use this, when we need to treat dexdomitor-induced bradycardia, it is not recommended to use atropine to treat dexdomitor-induced bradycardia. Adverse cardiac events can happen. So first we need to reverse dexdomitor with atipamezole, then we can reassess and determine if it's needed later. The respiratory system, guaifenesin, GG, it's going to be an expectorant. We use this for horses, and it makes intubating horses easier. This is done by feel. We place a gag in the horse's mouth and place it by feel. And the solution, it comes in a 5% solution. 5% times 10 gives us 50 mg per mil. Diphenhydramine, also called Benadryl. This is going to stop the release of histamine, and this can cause sedation and occasional GI effects. Aminophylline, this is going to cause bronchodilation, and it can also cause mild cardiac stimulation. This does have drug interactions. Fluoroquinolones, remember the article, The Jumpy Pug? This can make animals very, very sensitive to responses. And this will also decrease efficacy with other drugs, so we need to monitor what drugs are being given along with aminophylline. Doxapram, Dopram, Respiram, you already have this card. It's going to stimulate the respiratory center of the brain. It has a wide margin of safety. We can see hypertension, arrhythmias, hyperventilation, and seizures. This is controversial because the respirations that are induced with doxapram may not be as efficient, and it can lower the seizure threshold. We will administer this intravenously or sublingually, especially in puppies. For gastrointestinal drugs, apomorphine, this is going to cause emesis. This is going to trigger the vomiting center of the brain. It is a scheduled drug, cancel that one. So this is a scheduled drug, and it is a synthetic opioid. So I'm going to cross off, not scheduled. It is a scheduled drug. So we need to log this in our controlled drug log. The drug family that this belongs to is a synthetic opioid. This is used in dogs. We do not use apomorphine in cats. This can be placed in the conjunctiva sac, or it can be compounded for an IV injection. And after emesis, once we have had the results that we want, we will need to give an antiemetic. Xylazine, also called Rompin. This is going to be used to induce emesis in cats. It belongs to alpha-2 agonist drug family. And after emesis, we need to give an alpha-2 antagonist. Keep in mind too that we can use other alpha-2 agonists to induce vomiting at correct dosages. We can use dexmedetomidine or dexdomitor. We do not want to use the sedative dose though. Maropitant, also called Cerenia. This is going to stop vomiting at the vomiting center of the brain. It is preferred to other antiemetics because it is safer for gastrointestinal obstructions. It will not speed the gastric contractions or gastric emptying. Metoclopramide, also called Reglan. This is going to be our other centrally acting antiemetic. It also will work peripherally to stop vomiting. It is contraindicated in cases where GI obstruction has not been ruled out. It will also increase the gastric contractions. It is contraindicated because it can cause perforations. Famotidine, also called Pepcid. This is a histamine receptor antagonist, and it's going to reduce the release of hydrochloric acid. We use this often in cats who are chronic renal failure. Sucralfate, also called Carafate. This is going to form a paste-like substance in the stomach. It will bind to ulcers in the GI tract. We administer this by dissolving it in water, shaking it up, and we administer the liquid by mouth. We should give this in an acidic environment, so it's best to give sucralfate 30 to 60 minutes before our histamine receptor antagonists such as Pepcid. Loperamide, also called Imodium. This is going to decrease our intestinal secretions. It'll increase segmental contractions, and it'll increase the intestinal absorption. This is added to it is atropine, and that's to prevent abuse because this is an opioid, and this is a synthetic opioid over the counter. Flagyl, metronidazole. This is going to treat protozoa, anaerobic infections, and inflammation. More on this one in the antimicrobials. Ophthalmic drugs, atropine sulfate is drops. This is going to cause mydriasis and cycloplegia. This will help to dilate the eyes, and it'll help to paralyze the muscles around the eyes. Adverse side effects, this tastes bad, so expect the animal to start drooling, and it is contraindicated in cases of glaucoma and keratoconjunctivitis sicca. When used in rabbits, atropine esterase, the enzyme, is produced in 30 to 50% of rabbits, so atropine may not be as effective in rabbits. Pilocarpine, this is going to be used to treat glaucoma and keratoconjunctivitis sicca. It is a cholinergic or parasympathetic drug. It will stimulate tear production. Proparacaine hydrochloride, this is going to be a topical anesthetic used in the eyes. It has an action of 5 to 10 minutes, and you will find this in the refrigerator. Bacitracin neomycin polymyxin, or BNP. This is an antibiotic. Sometimes we add in dexamethasone, and this is a steroid that is contraindicated in eye ulcers and injuries. Same thing with hydrocortisone, steroid that is contraindicated in eye ulcers and injuries. Otic drugs, gentamicin sulfate, is called Otomax. This is used for otitis externa, yeast, and bacteria treatment. And adverse side effects, because this is an aminoglycoside antibiotic for gentamicin, it can cause ototoxicity and nephrotoxicity. Nystatin neomycin, also called Panalog. We use this for otitis externa, yeast, and bacteria. It has a combination of drugs in it. Adverse side effects are ototoxicity and nephrotoxicity because of the neomycin. And the neomycin is an aminoglycoside antibiotic. Ivermectin, also called Ivomec, is used for ear parasites. And we use this in cats for ear mites. The routes that we can use, we can apply this inside the ear, and in some cases we may use an injectable format of it.